right, good morning, everybody. Thank you all so much for coming out on this beautiful spring day to discuss a super important topic here for the future of our city and the country as well. Before I start, I want to thank Sherry Bryan Hamilton, Councilman Hamilton, for hosting us here in your district. And we'll be hearing from Council President David James at the end of this, so thank you. Okay, let's step back a little bit and think about kind of the big picture of what we're trying to do as a city. You know, we often try to say, can we get the trifecta of combining our city values around lifelong learning and compassion and health? And those are the filters through which we see our actions. And you can see that whether we're trying to grow our economy, we're trying to create a great park system, maintain that, trying to grow our rapid transit system. But those values are especially hopeful and guideposts when we tackle a crisis that's the size and the scope of the drug epidemic that's hit our city and most of our entire nation. America is facing our largest and most serious drug epidemic in history. In the last 15 years, almost 500,000 Americans have died from drug overdoses, and most of those deaths are from opioids. The disease behind this is substance use disorder, and it strikes everywhere. In 2016, our hardworking Metro EMS team performed overdose runs in every single Louisville zip code. And we've seen overdose deaths and overdose-related ER visits in our city rise to high and unacceptable levels in recent years. That's why we've increased overdose prevention training to LMPD, fire, and EMS, and have equipped all of our first responders with life-saving naloxone. It's why we created our Office for Addiction Services to better fight the opioid epidemic. And it's why we filed a lawsuit with County Attorney Mike O'Connell against the 3 largest wholesale opioid distributors for dumping millions of pills into our neighborhoods without monitoring, identifying, reporting, or halting suspicious shipments of opioids, as the law requires. We're working with Jefferson County Attorney Mike O'Connell, and we'll use any funds that we recover from these suits to get treatment to more citizens struggling with substance use disorder. We're making progress to fight the drug epidemic, but we know we have a lot more to do. We have to deal with this crisis by using a public health approach that does not stigmatize its victims. Instead, we want to offer reasons and resources that provide hope for healing and recovery. And that's why we're here today. I'm proud to announce the release of Coming Together for Hope, Healing, and Recovery. This is our action plan to address substance use in Louisville. This report addresses the root causes of substance use and misuse and discusses options for how to overcome it for individuals, families, and for our community as a whole. It addresses illegal and prescription drug use as well as tobacco and alcohol, which receive a lot less media attention, but are actually far more pervasive and deadly and affect far more people. The hard work of producing this report and action plan began last July. That's when the Department of Public Health and Wellness, under the direction of Dr. Moyer, convened a working group which include people in recovery and folks representing law enforcement, healthcare institutions, nonprofits, along with scholars, social workers, school officials, and concerned parents. Many of those people are standing behind me today, and I want to thank everybody that participated in this report. Good job to you guys. This diverse group thoroughly studied the challenges, examined initiatives already in place here in our city and in other cities, and created this action plan. And while this is a Louisville Metro government report, Coming Together for Hope, Healing, and Recovery is more than a title. It's our fundamental strategy for addressing this challenge, people and organizations across our community working together, taking responsibility for achieving specific goals within the larger action plan. And let's be clear, this is a serious long-term challenge. This battle may never be over, but implementing these recommendations will put us on the right path and help us start saving more lives. So now let me bring up our city's public health director and chief health strategist, Dr. Sarah Moyer. Her and her team have done a great job pulling this together on a very complex topic. Dr. Moyer.
Fischer. This is the part of my job that I love the most, coming together with great people to solve tough problems, improve the health of Louisville and of our friends, family, and neighbors. Our vision at the Department of Public Health and Wellness is a healthy Louisville where everyone and every community thrives. Public health and wellness can't do that alone. We need everyone. The people, as you heard, the people standing behind us, and many of you also that are in the audience, represent our community team, those that helped in their creation of this report. They helped with the analysis of our strengths and weaknesses, opportunities and threats in July. They helped us with the community survey in August, and then worked tirelessly in the work groups throughout the fall. And I can't say enough about my team at Public Health and Wellness, who spent countless hours researching, writing, and analyzing as well. So thank you all for making this report a reality. As Mayor Fischer said, our plan is the product of many, many people coming together, studying the problem, examining initiatives already in place in Louisville, as well as best practices in other cities, and creating a 2-year action plan to address substance use and misuse in Louisville by providing hope, healing, and recovery. This is the public health approach, an approach that has worked for other devastating issues like childhood illnesses and motor vehicle accidents. And the plan covers more than just opioids, because we can't just address one substance, as the landscape is constantly changing. We saw that with heroin being the most pervasive drug about 2 years ago, and now fentanyl and meth having a rise. And other states are also seeing a rise in alcohol deaths as they tackle the opioid epidemic. Plus, tobacco is still our #1 cause of death and our substance of choice here in Louisville, leading to the top 3 causes of death in our city, which is cancer, heart disease, and COPD. While these challenges of substance use disorder may seem daunting, they can be met and overcome. So I'd like to announce our top 10 strategies that the community of Louisville will work on over the next 2 years. Are, in our first section, hope, prevent and reduce youth substance use. A new community-wide coalition will work with families, schools, and kids to implement the best ways to keep kids healthy and active and not needing substances to cope with stress. Goal number 2, increase trauma-informed care. We know that trauma children face can lead to poor adult health outcomes overall and make them more prone to substance use. Trauma-informed care means we can work to build resilience in kids and help them get the care and services they need to reduce chances of those poor health outcomes. Goal number 3, reduce stigma, because words matter. We need to educate our community. Addiction, or better stated, a substance use disorder, is a true chronic brain disease and not a moral failing. When we use stigmatizing language, people are afraid to ask for help. Next section is healing, which is our treatment and harm reduction goals. So goal number 4 is increase harm reduction. Naloxone and our syringe exchange have been huge successes in our community these last few years. We need to expand those efforts and continue to save lives today. Goal 5, expand diversion from emergency rooms and jails. You'll hear more about that from our partners with Centerstone in a minute. Improve connection to treatment. Expanding programs that put peers 24/7 in hospital emergency rooms to immediately relate to those in crisis and show them recovery is possible and connect them to treatment, all the treatment facilities in town. Goal 7, measuring the quality of treatment programs. There's a wide variety of treatment programs in Louisville with different strengths. Measuring outcomes and making data available to patients will help connect patients to programs that best fit their needs, and will give us the data to invest in resources into programs that work for our community. The last section is recovery, because as a chronic disease, substance use disorder is a lifelong battle that doesn't just end after treatment. So goal number 8 is to establish guidelines for sober living houses through a local ordinance. Those in recovery deserve to know that the recovery residency will be supportive. And goal 9, make expungement affordable. You'll hear more from that from Sadiqa here in a minute. And lastly, goal 10, which is improve job placement. Employers are telling us that they need good workers, and people in recovery are telling us they can't get good jobs because of issues related to past criminal charges or the medication they may be on. So we need to figure out a win-win situation for this. These 10 recommendations span the levels of the social ecological model, which is public policy, community, organization, interpersonal, and individual. Or as we like to say at Public Health and Wellness, the layers of society. We must include interventions at each of these levels in order to reinforce their impact and make sustainable long-term change. So again, please check out our report on our website, and I want to thank all the organizations and individuals across the community who have stepped up, provide input into the plan, and to champion each of the plan's goals. This is going to greatly increase our chance for success, making Louisville a city where everyone and every community thrives. And the work is just getting started. It's still going to take all of us to move it forward. Many of the initiatives need funding, more community volunteers, and political movement. But when we come together, we are fostering hope, healing, and recovery, and we will overcome this epidemic. So thank you.
Thank you, Dr. Moyer. Okay, now we're going to hear from Kelley Gannon. Kelley is the Chief Operating Officer of Centerstone, Kentucky. Centerstone is an owner of one of the healing plan goals, expanding diversion from emergency rooms and jails. So Kelley's going to tell us about Centerstone's Living Room project. Kelley?
Hello, everybody. My name is Kelley Gannon. I am the Chief Operating Officer with Centerstone. And at Centerstone, our vision is to deliver care that changes people's lives, one at a time, in the community. And that's exactly what we're doing. We are at the forefront of the epidemic. We see every day the devastating effects that are happening because of this epidemic. And then back in December, 3 months ago, we put on the floor or on the ground a new solution to the problem. We partnered first with Louisville Metro Police Department. I think we actually may have earned a badge because we've been at so many roll calls to share this program about the living room. What the living room is, it's a 24/7 place where someone in crisis can come and be treated welcomed, no matter your crisis, and we're going to help you, link you with services that are going to help you find that hope in the recovery that you're looking for. We know that striking when someone's in crisis and linking them to services is the best thing that we can do. Putting them in a jail cell, which is what the police have had to do so often because they have committed a crime, but the crime is related to either a mental illness or a substance abuse issue, it is not helpful. And what happens is there is recidivism in the door, and it is constantly going. And if they come to the living room instead, the police get to say, here you go, I didn't really know what to do with this person, but now I have a solution. They have drop-off time, 2 minutes, 2 minutes for the police. And when you think about that, if they had to take them to the jail versus bringing them to us, they can get back out there on the street, which is what they want to do to keep our city safe. So we've had great results. We've seen over 200 people already in 3 months, and we're linking them to those services. And already we're able to estimate at this point that we've saved a $500,000 in taxpayer dollars to the community by linking them to the living room. We couldn't be happier to be here. Coming together is what we're all about, and providing services and partnering with people in the community. Metro Council has really been helpful to us and getting the living room off the ground. We couldn't have done it without them, and we're really hopeful with the support of Louisville Metro Police Department, the Health Department, Metro Council, and Corrections that we're going to really expand the living room and do more good work around this crisis. We're just happy to be here as a partner, so thank you very much.
Thank you, Kelley. As has been mentioned, we know that recovery entails removing barriers to employment and a productive life. One of the recovery goals of our plan is to make expungement affordable. So I'd like to ask Sadiqa Reynolds, President and CEO of the Louisville Urban League, to say a few words about expungement.
Hello, everybody. I'm really excited to be here and so thankful that our community and our Department of Public Health and the city understands how important it is for us to work on this issue of expungements. I want to acknowledge one of our partners that's here in the audience, a very unusual partner for the Louisville Urban League. Wyatt Tarrant Combs, Andy Payton is here with us today because you have to have lawyers partnering with you on this kind of work. And so the focus of the league is jobs, justice, education, health, and housing. And what we have found is that there are so many people who have paid their debt to society but can't really overcome some of their historical challenges. And many people, when we originally decided to have the expungement clinic, said, will you have enough people show up? Will people really wait in line? Will they do that? Well, we were able to serve hundreds of people, but we certainly turned away more than 1,000 people who really did need this help. And I would say to anybody, nobody waits in line for 10 hours if they've got the $40 to file the expungement work. So what happens is $500 for a felony expungement to be removed. That's per charge, $100 for misdemeanors, and then there also is the cost of running the Kentucky State Police report. So this is really cost prohibitive. So while we have made expungements available in our community and in the Commonwealth, we haven't really made it accessible. And so with the help of some lawyers that will, do this work pro bono, we have been able to really make some strides, but it's a very, very small sample. So I'm excited about this work. The league is looking forward to leading this work along with our partners, and I can assure you that we will have others that will come to the table, but because we can't really do this alone, we really are going to have to push in our community and in our state for policy changes. So what does that mean? Well, many people probably think that if they are arrested and you go to court and the case is dismissed, that is magically removed from your record. That is actually not the case. You actually have to go back and file to have that record expunged. If you are taken to trial and you are acquitted, some people think that it would be removed automatically. That is not the case. And so what happens is you have folks that are walking into employers, and the employers are getting a history that may or may not be accurate. So obviously, though, if it's expungible, it's something that meets the law, the requirements, maybe more than 5 years old, dismissed, acquitted, whatever the case is. And so we don't want people, because of poverty, to be stuck in that cycle. So we are going to be working together to push not only on the Band-Aids, which is what I call the programs, right? So we'll have more expungement clinics. Those are the Band-Aids. But the fix, the surgical procedure, will be really getting to the root cause and being able to change the policy that is breaking some of these folks and keeping them tied to a past that they would like to forget. What I did find interesting, and I want to say this, I think it's important, when you think about hope, there are so many people who are so ashamed of a past of 10 and 12 years ago. They are self-selecting out of the job market or self-selecting out of moving up into other opportunities because they don't want to be asked. They don't want to be told no again. So by helping to change these laws and change these policies, we can really empower an entire community of people who absolutely deserve to be fully engaged. And then the last thing is for us all to remember the impact that even having this criminal record might even have on housing and affordable housing. We certainly understand that we have an affordable housing crisis in our community, and so we don't need to be a part of one more barrier. So I'm very proud of the work that Dr. Moyer has asked us to do, thankful for the city and thankful for the council, Councilman James, and also Stephen Riley on the Riley Reentry Program, because it was them who first piloted our expungement program a couple of years ago and led, council did that, and then led to Stephen Riley picking it up and giving us the nice donation for the expungement clinic, the Riley Reentry Program. So thank you to the mayor, thank you Dr. Moyer, council, and Stephen Riley. Thank you to this community for being willing to do this work.
Thank you, Sadiqa. I want to recognize Representative Darrell Owens. He's not here, but he's been a relentless warrior for us on expungement issues in the state capitol. And this is really where we all need to be advocating. The $500 is a number that's set in Frankfurt. It could be zero. Okay, you could be automatically be expunged when you set your time. So while we're doing tactically what we need to be doing here in our city about this issue, let's also remember to advocate with the state Senate, the state House, the governor to take care of this issue once and for all. I want to really say too, the recovery community is such an important part of this work. And I'm so proud of our recovery community here in Louisville that steps up and steps out and embraces people that have substance use issues and says, come on into our family. Because it is hard to work through substance use, substance misuse, and you need massive support from the community. And when you see the recovery community surrounding somebody to help them get on a more positive path, if they fall down again, we surround them again with hope and love. I mean, that's just what's required. So there's so much strength in our recovery community here in Louisville, and I'm very, very proud of them. So everybody should support our recovery community. And it was essential that our working group included the perspective of someone who's fought and overcome substance use disorder. Tonya Brashear is with us here today, and she's going to share some words with us here about the courage and dedication that was required to move through this very challenging situation. So please welcome Tonya Brashear and Dr. Moyer.
So I first just want to thank Tonya for being part of our recovery work group this past fall. So thank you, Tonya. It was very important to have that perspective as we were going through what we were going to include in the plan. So Tonya, you could share a few words about what the experience was like and what made you want to be part of one of our work groups.
First of all, I want to say that it was an honor. Last month I celebrated 2 years clean and sober, and it was an honor to know that I was going to be sitting among people that were never even in that position, that actually cared. So, and wanted to do something to help, because I lost people who did care about me in that situation. Husband of 18 years, my family, my home, my career, and at that point you do lose hope, you know, and it's just easy to go back and not think about everything that you've lost. So I did that the first time I got in trouble, but the second time I realized I had to make a choice. And the choice was to replace my negative thoughts with positive thoughts, and know that I can get it back, whatever it is that I've lost, and more. It's just going to take time and some hard work. I didn't get that way in one day or two. I'm not going to get it back in one day or two. So, and I want to give a shout out, you know, to Miss Sandra King from My Chosen People Incorporated. That she was a wonderful help with lots of resources, and I don't know what I would have done without that lady. Also Daryl and Tiffany Davis from the Prisoner's Hope. I met them sheer accident, and they were a wonderful help. And then, so when you have resources and people who step in to help you and show you that they care and give a belief in you, then you then can learn to believe in yourself, and that made me want to be a part of your guys' project to give back, and that actually helps me as well. And so I was very honored to do that, and I just want to thank you.
We thank you.
Thank you, Tonya. I also want to give a shout out to another person that's not here, and that's the mayor of Boston, Marty Walsh. Marty has been clean and sober for about 20 years or so, and he uses his pulpit with the United States Conference of Mayors, where we formed a task force to work on this issue, to raise the elevation of substance use and misuse amongst all the mayors across the country. It's probably our most rapidly growing task force. And for a mayor of a big city like that to constantly be talking about these issues has really helped to humanize this challenge that we have as a society. So just most of y'all don't know Mayor Walsh in Boston, but I want to let you know he's a great national voice on this issue. Before we wrap up here, I'd like to ask Metro Council President David James to speak on this issue. Councilman James has been very involved with substance abuse issues over the years, both as a police officer and now with the council, and has been a tremendous partner on this effort. President James.
Well, good morning, everybody. I just want to acknowledge my colleagues first. Councilman Sherry Bryant Hamilton, thank you for letting us be in your district today. Councilman Parker, thank you. I want to take a moment to say something about Mayor Fischer. I have been a police officer for 30 years of my life, spent 15 of those years working in narcotics. And I have to say, Mayor Fischer, the focus that you have on this issue has been amazing. And out of all the years that I've been around the city of Louisville, I have not seen a leader in this community push this issue as hard as you have, and I'm very, very thankful for your leadership. And I want to thank Dr. Moyer for having the ability and the courage to bring us all together to try and come to consensus on some things. And I know it wasn't easy, but you worked through it, and thank you very much for your leadership. And the participation of everybody in this community, all over our community, on this issue of substance use disorder and alcohol use disorder is very important. And the importance of humanizing it and making it real for everybody in our community to understand that it's not some secret bad word. I can remember a time when we weren't supposed to say we have a drug problem in Louisville, and that's not the case. We have people in Louisville that we have to help. And so one of the things that's in our report that we talk about is sober living environments. And it's very important that when we talk about that we make sure that the sober living environments that people that have this disorder go to are safe, clean, and supportive sober living environments. Because we do have a problem with some places that are not, and they simply take advantage of people that are already in a bad situation. And so part of our conversation has been, how do we make sure that we put some regulations in place that we protect fragile people that are trying to get help? And so as the president of the Metro Council, I pledge to you, I'll work with you, I'll work with the mayor to make sure that we have great regulations to do that. I also want to take a moment to thank the mayor and County Attorney Michael Connell. It was mentioned just a little bit earlier, but us filing a lawsuit against the drug companies that have been pumping drugs into our communities across this city and across the state illegally under the guise of legality, and actually taking them on for what they've done to us is very important. And so having the courage to do that, I want to say thank you, Mayor. I want to say thank you to Michael Connell also. And so with all that being said, since everybody's talked, I'm going to take this moment to shut up. Thank you.
Thank you, President James. I want to recognize Steve Durham here also from Metro Corrections. Our Metro Corrections has been, I think, the leading facility in the country relative to treatment of substance abuse. Their Enough is Enough program, modeled after the Healing Places mission and program, has been nationally recognized. Running a jail of 2,000 folks is really complicated, and some cities just try to get people in and get them out. I'm really proud of Director Bolton, Steve, and the whole team there, who really dive in to say, while we have these folks here, can we help them? And our Enough is Enough units that do that day in and day out. So just want to say, great job, wonderful work you guys are doing. Finally, I want to say thanks to Bill Wagner and Dr. Bart Irwin and everybody here at Family Health Centers. You guys help this community 365 days a year in a great, great way. But really appreciate y'all hosting us here.